Well, today on Shop South Mississippi, we're back in the office of Dr. Sonya Spencer over in Gulfport on Pash Road. And of course, Dr. Spencer, chiropractor. How are you again?
I'm doing great.
It's good to see you.
It's great to see you.
Now, a lot of people think that you go to a chiropractor, you're going to get your back popped. And you're going to get your neck snapped.
Right.
But there's a lot more to it, and more technological advances have come along to help relieve the pain. And you're going to show us some of that today.
Yes, I am. Today we're going to be talking about neck, shoulder, and arm pain. A lot of people are in positions now, where they're bending over their computers, they're texting a lot, working, looking down, and we get this problem today called forward head posture, where your head is kind of in front of your body, and your posture will begin to affect the nerves that come out and go down into your arm. And this is a cause of arm complaints for many people.
Really?
Yeah, it can affect your shoulders and how well you can move your shoulders, use your arms. So a lot of times people don't even have neck symptoms, but develop arm symptoms, especially as they age. So their arms may even get weak, and they have numbness, tingling,
tingly feelings.
different
I get
things
that
like
from time
that.
to time.
Yes, so you definitely need to get your neck checked because these nerves that come out of your neck here go down into your arms and can definitely be affected. So let me show you a little bit about what the forward head posture looks like. So what we would start with a patient like you would be an examination to see if you have forward head posture.
Okay.
So an examination on your x-ray would be like taking a picture of your neck from the side. And if your head is forward, bent down, for example, this patient right here, this part of her neck should be way back here. So the head is leaning about 2 inches forward.
Wow.
So over time, it's caused these discs down here to deteriorate. It's putting a lot more pressure on the bottom of these nerves down here. You see how these discs up here are nice and thick, and then down here they're really deteriorated and got some bone spurs going on right here.
Right.
This is what people call deteriorated disc or degenerated disc. And a lot of people think, oh, I have degenerated disc, chiropractic can't help me. But these are the people that need chiropractic the most, because chiropractic actually helps stop this process from accelerating, and can actually help relieve the nerve pressure by getting this joint mobile again. And we offer a specific exercise program that will help correct this person's forward head posture and kind of get their head back over their shoulders where it belongs.
So you're supposed to stand up straight, keep your head up?
Well, this person's not doing this on purpose.
Right.
Well,
like you
their
said,
gravity started to work on them over time. So if you spend years and years in a position, an accounting position, or doing manual labor where you're down a construction worker, or any type of
graphic artists that are still working on computers all day long. Yeah.
If you spend many years doing this, or if you've been in an automobile accident, it's a major cause of this type of problem, you definitely need to get your neck checked, especially if you're having arm symptoms.
Okay.
So, because this type of problem can definitely lead to fibromyalgia. A lot of people are misdiagnosed with fibromyalgia who have this type of misalignment going on in their spine. Now, I want to talk to you about what we do for patients who have very difficult cases. We have this cold laser that helps the body heal at a much faster rate. And what we do is we place it on the area of the body. Say, for example, a patient is going to have an irritated nerve coming out of their neck.
Right.
So what we would do is we would point this on those irritated nerves right there, and this would allow the nerves to heal much faster than the body could do that by themselves. It does that by speeding up how fast the nutrients can come in to the cells and the waste products can come out. So that's what we would do for difficult last resort cases, especially those who haven't responded to other treatments. Now let me tell you a true story about this. We actually had a patient who was scheduled to have neck surgery because he had numbness and tingling down his arms and hands. And he went in to have his pre-op, and his heart was too weak for him to have his neck surgery. And instead of having his surgery, he ended up in a chiropractic office to treat this problem. It turned out he didn't even need the neck surgery. We were able to relieve him of all of his symptoms, and he was so glad that he didn't have his surgery.
Wow.
So I want to tell people, you know, chiropractic first, drugs second, and surgery only as a last resort.
Right.
You know, so many people are having spinal surgeries, and they're not always necessary. So, you know, the numbness and tingling that you may be experiencing, you know, don't go out and, you know, have a spinal surgery.
Surgery is kind of permanent.
Yeah, you can't undo a surgery, you know, and always try conservative things before you go have a surgery.
And, you know, and beyond just what you were talking about as far as the laser treatment and everything, you said that you teach them a little exercise thing too, and
right.
which the way to exercise right.
Exactly. What we do is we combine chiropractic adjustments, the exercise, and the cold laser therapy, and we get phenomenal results with this type of treatment.
Wonderful.
Yeah, it is fantastic. And we have a wonderful program called the Chiro Health Program that allows people to get discounts on their first visit to our office. So many people don't have great insurance nowadays.
Right.
So for people who have no insurance or underinsured, we have the Chiro Health Program. Now the Chiro Health Program allows them to join a program that is $39 to join, and they actually get their first visit, which includes their examination and their x-rays, for only $39.
Wow.
I know. And you know, the whole first visit, you know, that saves them over $200
That's awesome.
on our Chiro Health Program. And by joining that, you get discounts on our laser treatments. The laser treatments are, you know, can run up to $60 a treatment, more if I'm doing an advanced treatment on them.
Right.
But they can start as low as $20 on the Chiro Health Program.
Nice.
Yes. And this is a very effective treatment combined with chiropractic, you know, to help save people money.
Sure.
This Chiro Health Program makes this whole healthcare package very affordable, especially for people who don't have insurance.
That's great.
And I am a preferred provider for Blue Cross, Blue Shield, Medicare, Aetna, and all types of insurance. So give our office a call.
Very good. Well, the number's on your screen. If you'd like some more information, you can contact Dr. Sonya Spencer and make an appointment to come by and see her. She's located on Pass Road in Gulfport, kind of halfway between Courthouse Road and Washington Avenue in Gulfport. Dr. Spencer, good to see you again.
Thank you.
Very informative. Again, if you're having some problems with your neck, that maybe that little sitting forward, and you want to try to alleviate it, make an appointment and come see Dr. Spencer in Gulfport.